Hi everyone. For this month's virtual coffee with, I am really pleased to welcome Peter Hadley, who is a service manager at NEAMI National. So thank you so much for making the time to have a chat with me today, Peter.
A pleasure to be here, Sharon.
And before we begin, I would like to acknowledge the traditional owners of the lands from which we're both meeting today and pay our respects to elders past, present and emerging. And for me, that's the Wurundjeri people of the Kulin Nation. And what about you, Peter? Where are you coming from?
I'm in the Outer East, so I'm also on the lands of the Wurundjeri people as well.
Fantastic. And given that it's a virtual coffee with, are you a tea or a coffee person?
Very strictly coffee. So I brought my cup just in case.
Fantastic. Not so easy when you're working from home. Are you able to make your coffee of choice working from home, or do you have to nick out and pick that up?
I like to nip out when I can because it's a good excuse to get out and see people that aren't on a screen, but I thankfully have a decent coffee machine at home, so it hasn't been too much of a struggle.
Great, that's good to hear. So can you tell me a bit more about NEAMI and your role and what you do there?
Yeah, so I work for NEAMI, which is a mental health organisation that started in the northeastern suburbs of Melbourne back in 1987, and so was born out of the sort of deinstitutionalisation of the large institutions that were based around there. And so NEAMI used to mean the Northeast Alliance of the Mentally Ill. Now it's no longer an acronym and is just a name as the organisation has become a national organisation. And so I'm one of the service managers at NEAMI, and I oversee two different programs. So one of the programs I oversee is what's called the Psychosocial Support Service. And so it's a federally funded program to provide one-on-one and group support for people with severe and persistent mental health concerns that are not otherwise supported through the NDIS, and is very similar to the EIPSA programs, which is a state-funded equivalent for people that are attached to clinical services. And so that program's funded through the Eastern Melbourne PHN, and so covers their catchment. The other program that I oversee is the Preventative Health Initiative. So this is also a federally funded program through funded through the East Melbourne PHN, and looks at supporting people with mental health to engage in some preventative health activities. So we have 5 main focus areas, which are breast screening, bowel screening, cervical cancer screening, influenza immunisation, and smoking cessation. And this comes from some federal funding that is looking at addressing the life expectancy gap for people with mental health. So on average, people with mental health are likely to live about 15 years less than general population. It's not the same as our First Nations folks, but it's fairly close to that gap in life expectancy for those populations as well. And so this program's delivered in a number of different ways. One of those is capacity building, which is training and health promotion and building health literacy of service providers. And the other is individual support to people experiencing mental health that need that preventative health support.
Fantastic. Wow. So 2 quite different programs by the sound of it, and at sort of with different aims in some ways, you know, the preventative health side, which is obviously really, really important. And, you know, an incredible statistic to hear, you know, how mental health concerns does affect people's life expectancy so significantly.
Hmm.
So,
Yeah, and I guess the Preventative Health Initiative was one that's come through the Eastern Melbourne PHN Catchments Needs Assessment. And so as a region, broadly, we have some of the highest smoking rates in Victoria, and low screening rates. And this is across the general population, and we know that's worse for people experiencing mental health as well. So there's a real need for this type of support in our area.
yeah, for sure. So tell me a bit more about what excites and motivates you in your role as service manager at NEAMI National.
Yeah, great question. And I was reflecting on this a little bit in sort of preparation for this. And so NEMI is an organisation I've been at for a very long time. And for me, that's because NEMI is a organisation that, as much as an organisation can, lives its values. And they do this in a number of ways, predominantly through the people that they employ, and that's done through a values-based recruitment. So trying to get the right people within the organisation. And NEMI uses recovery models in all the programs that we deliver, and the two programs that I oversee, while vastly different in a lot of ways, have the same core fundamental underpinning values and ways of working, which is using a recovery lens, and looking at supporting people with mental health to have as much full participation and full citizenship as possible. And so NEMI supports staff in the same way that it supports consumers, through looking at our own growth and professional support. And so it's an organisation I started in as a support worker way back when, and was doing one-on-one support. And I've been supported to be nurtured and grown and challenged through leadership. And I've been in leadership for, God, I think about 7 years now. And so it's somewhere that really kind of challenges me and sparks my interest and helps me grow. And I believe in the work that we do.
Mm. Oh, that's fantastic to hear. And sounds like what a great experience that's been for you.
Yeah, it's been fantastic. I still don't know what life outside NEMI would look like, and I guess I'm in no hurry to find out at the moment, as long as I'm still
Yeah.
challenged. And there's something really nice at being able to turn up for work at somewhere you believe in, and doing work that really fits with your own professional values.
Yeah, absolutely. So given the huge impact of the pandemic on all of our lives, how has it affected, what reflections do you have about how it's affected the clients or the consumers of NEMI and the way that NEMI delivers services?
Yeah, it's been a really interesting one in terms of the consumer experience, because it's vastly different. So for some consumers, there's been a sense of relief, where people have been quite isolated prior to COVID and have struggled with social interaction and getting out of the house. For some of those people, it's been a relief in terms of, oh, this expectation's now gone, and actually I can go to the shops and there's less people there. And if I don't go out for a week, that's okay, and I don't have to go more than 5 kilometers when we're in some of those times. But for other consumers, people, it's been a really isolating experience. And so particularly at those times of restrictions where outreach and face-to-face support has wound back a little bit, that has lowered the contact that people have had, because sometimes a worker is there predominantly the face-to-face contact that some of our consumers have. It also is really challenging around, as for all of us, around how do you self-care when some of those things that we do for self-care are now not able to be accessed.
Mm.
And like for all of us, there's a loss of some of those incidental contacts. When you're in the supermarket with a mask on, it's much harder to smile at, say, the person behind the counter and have a little bit of that sort of light banter, that how you doing, or at least get a smile or some kind of recognition and feedback. NEAMI very early on moved to telehealth as we had to, and the response from consumers has been quite interesting, and there's been quite a high uptake of telehealth, which surprised us. We thought there'd be much more resistance to that, and for some consumers, they're wanting to continue that post restrictions and into those COVID normal spaces, and so we're looking at what blended service delivery looks like. Unfortunately, with the multiple sort of lockdowns and changes to restrictions, that has led to some accumulative, what we'd call trauma for consumers. And so for a lot of our consumers, we're trying to maintain face-to-face contact where we can, just because it is getting more difficult the more restrictions and lockdowns that do occur, and that overwhelming sense of, and when does the next one come? And so people having to wrestle and deal with that experience.
Yeah, for sure. I can fully understand that. Mm. I'm just wondering about coming back to the work that you were talking about in the preventative space, and thinking about particularly physical health and what influence that has on our mental health, and in what ways is NEAMI National addressing some of that? Is it part of that program, or is it something else that you're working on?
So NEAMI more broadly looks at physical health in all of our programs, and we often have a physical health prompt that's part of our service delivery. But I would rather talk about specifically in the preventative health program, because it's really an exciting space for myself and some of the work that's happening there. And I guess one of the big parts of what we know and we knew before we started the program is for people with mental health, physical health can be a challenge to have those needs met. Particularly, a GP appointment is normally 15 minutes. That's a lot of time. It's not much time when people are bringing mental health to that space to also then look at physical health, and we understand the limitations of that for GPs and their time pressures, and we understand even for mental health services with people with really complex mental health needs, that may lead to crises around housing, substance use, mental health crises, or other factors in their life. That physical health can unfortunately be the one thing that falls by the wayside or gets less attention until the point where it becomes another crisis to add to the things that people are struggling with in their life. One of the really lovely things about this program is, because it does have that focus on those screens, as well as the immunizations and the smoking cessation, they're really achievable goals for people that may have really complex things happening in their lives. And so it can be a real motivator to, if you get a cervical screen done or a bowel screen done, it can leave people with this sense of achievement. Hey, I've been able to do something. There's one thing on my list that I've actually got done, and can start building up some of that confidence. Hey, maybe there's some other things that I can kind of tackle, and can be a real kind of motivator for other things in people's lives. So we can see it as a bit of a stepping stone, rather than this sort of thing that's sort of pushed to the side. It's one of those things that can be done to kind of help some of those other parts of people's lives that are maybe in chaos or crisis, or be quite complex spaces, that this simple thing can maybe help with those rather than being an add-on. And I guess what we're noticing about the consumers that are being referred to the program is often they're coming with some really complex physical health issues anyway. Issues around pain management is one of the real big ones that we're seeing at the moment. You know, so those are some of those things that we can build some of the health literacy, and through supporting people around these preventative health focus areas, and that may then also support people to go on to look at addressing some of those other physical health issues in their lives. And some of that comes back to fundamentally having some good primary care there and some good health literacy. And so a lot of our work is building people's health literacy and confidence in talking to those professionals, and see that people can make some real positive changes in a short amount of time.
Fantastic. And it sounds like that's also some really useful tools for people, you know, that they'll use into the future. So it's not just a short-term benefit, but, you know, in the longer term, that will always help with their physical health.
Yeah, and one of our baseline measure of success is, has this person ended up having a positive experience of a health professional? So our one-on-one individual support is delivered through registered nurses, and we have a lived experience worker as well. And so we hope even that interaction with a healthcare professional that's supportive and gives people a positive experience will lead to them feeling a little bit more confident or a little bit more curious about maybe there's going to be another supportive healthcare professional down the track as well, and build their confidence in that way as well.
Yeah, such an important step.
Hmm.
So we've just come out of another lockdown, still experiencing some of the restrictions. What strategies can you share with people who might be watching this about how you've been able to keep yourself well and connected during these times of being in and out of lockdown?
So I guess there's been a couple of ways we've done this, and in a work context, it's really been looking at what collegial support there is, and that sort of sense of team morale. So there's how I keep myself well, and part of that's about keeping the team well as much as possible as we can. And some of that's about providing opportunities for incidental catch up. So for one of my teams, they have a tea and yoga once a week. Not much yoga happens, but lots of tea happens, and informal chat. And it's a way of trying to keep some of those water cooler conversations and those incidental kind of catch ups going. And so using the virtual means as much as possible to stay connected, and using those times where can find a reason to go into the office and it's safe to do so, to do as much face-to-face as can when it's able to be done. For myself, a lot of my self-care has had to change through restrictions, and so I haven't been able to do some of those big, more restorative self-care practices. And so what I try and do is sprinkle what I like to call micro self-cares throughout the day. Some of those little things, and it can be as simple as just letting people know in a meeting, I'm going to be a couple of minutes late because I need a stretch or I need a walk, so that I can come and be present in a space. And it's been a real wrestle for me with that one, to go, oh my God, I'm going to be late for a meeting, because time management's been a real, it's a real strong point of my practice. So by allowing myself to have that time to go, no, this is about self-care, and having a lot of those kind of things dotted throughout the day, those little moments of joy, those little moments of gratitude or those little bits of forgiveness really kind of help me through on the day-to-day basis.
That's some really important tips for everyone, I think, there. Sorry, you were going to keep going?
And I guess, it's still looking at some of those bigger things when you can. And those are often, for me, around connection and meaningful connection. And so looking at how I can have some time either in my day or in my personal life to have some genuine connection with others, and being really kind of mindful of that. Particularly, the challenge is screen fatigue that we can experience, and so thinking about the ways can do that don't add to that feeling.
Absolutely. So I think those are some really important tips for everyone. But with the restrictions that we've had and the lockdowns that we've experienced, is there anything that you've secretly enjoyed about being tucked away at home in these times?
Yeah, so there is one that it's kind of a dual one, because I enjoyed, and so it's about commuting. So used to enjoy commuting at the end of the day as a way of debriefing the day, and so I do miss that element. But I really like being able to, you know, be a little bit more lazy or a little bit more relaxed in the morning and go, oh, it's nearly time for work, and I can just press a couple of buttons, log in, and I'm ready to go. And so that's been really nice for me. And the sort of didn't kind of notice how stressful peak hour traffic is until after I didn't have to do that on a daily basis. And so that's been something I've really enjoyed. While it doesn't look like it today, the having a more casual dress sense and the sort of a lot more forgiveness from partner agencies and from the team about dressing a little bit more casually than I would have normally prior to COVID. And so it allows a bit more freedom with self-expression and some of that stuff. So that's been really nice. And then the final one is a really kind of counterintuitive one, because we've been in isolation and lockdown and had those restrictions, but in some ways it's brought out a greater sense of community for me. And so notice the local community and notice those things like the Spoonvilles and some of those other little bits of beautiful connection that people have done in the community to kind of help foster that, has been a really kind of joyous take out of these restrictions and these times. And so once again, it's a real strange one, because we've had a lot of those, for want of a better word, freedoms rolled back, but it's brought out the beauty in community. And so that's been really nice to appreciate that and notice that.
Yeah, definitely. I really noticed when the 5K limits kick in, how our local park where I usually walk becomes so much more busier, which I've been really, really enjoying, just seeing our amazing assets being used and used well by people that I wouldn't normally see. So it's been lovely.
Yeah. One of my favorite moments was driving past a house when we were in the sort of 5K restrictions, and there was one family had set up a fire pit in their driveway, and their neighbours had set up one in their driveway as well, and so they could maintain distance but have a connection over the fence. And that sort of idea of neighbourhood at times can seem a little bit notion of the past, but these times have brought that back to the fore a little bit, I think. So it's exciting times for maintaining some of that.
Yeah, absolutely. Well, Peter, I'd really like to thank you for your time today and sharing a little bit more about you and about your work, and also having a bit more understanding about NEAMI National and what the organisation does. It's been really lovely to speak with you. And I'm sure people watching this will really enjoy hearing more about your day-to-day. Thank you so much.
Really appreciate it, and I guess, you know, really passionate about mental health and physical health, and acknowledge the hard work that everyone's doing out there in the sector. And you know, it's really inspiring to be seeing some of the programs and the work that everyone is doing at the moment. So just want to say thank you to everyone as well for what they do.